Hola, buenos días, buenas tardes a todos.
Good morning and good afternoon, everyone. Welcome to the press briefing of the Pan American Health Organization, PAHO. Today is Wednesday, May 18th, 2022, and thank you very much for participating. My name is Luciana Viegas, Public Affairs Advisor of PAHO. We have interpretation into English, Spanish, French, and Portuguese. You will be able to ask questions using the Q&A button. We have received some questions via email, and thank you to all journalists who have sent them beforehand. Remember to give us your name and the name of your media outlet. We will begin with remarks by Dr. Carissa Etienne, Director of PAHO, who will give you an update on the situation of COVID-19 in the region. Dr. Etienne is accompanied by Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of the Department of Health Emergencies, PAHO, and Dr. Enrique Perez, who is the coordinator and of risk assessment and for COVID-19. Over to you, Dr. Etienne.
Good morning, and let me thank you for joining me for today's press briefing. New infections and fatalities of COVID-19 have been rising steadily over the past 4 weeks. Last week, our region reported more than 918,000 cases, a 27.2% increase compared with the previous week. Over 3,500 deaths were reported. COVID-19 hospitalizations increased in 18 countries, and admissions to intensive care units rose in 13 countries and territories. More than half of the infections were reported in North America, where cases have been climbing for the past 7 weeks. The surge is driven by new infections in the United States, which recorded more than 605,000 new cases, which is a 33% increase. Central America saw the largest rise in cases, with infections soaring by 80%. In South America, Brazil recorded more than 120,000 new cases, a 9% increase. Argentina had almost 34,000 cases, a 92% increase over the previous week. Infections also surged in other countries of the subregion, while Venezuela, Paraguay, and Brazil recorded an increase in deaths. Across the Caribbean, COVID-19 cases have been increasing for 5 consecutive weeks, with a rise of 9.3% in cases and a jump in deaths of 49% as compared with the previous week. 14 countries and territories in the Caribbean reported increases in hospitalizations. It is time to take stock of these numbers and to act. COVID is again on the rise in the Americas. The truth is that this virus is not going away anytime soon. After a period of lower transmission, many countries and local governments are abandoning masking and social distancing requirements and have reopened borders. But at the same time, too many people remain at risk, unprotected by vaccines. Only 14 of the 51 countries and territories in our region have reached the WHO target to vaccinate 70% of their population. We know that the elderly, pregnant women, and people with pre-existing conditions are at higher risk of severe disease or dying if they catch COVID. But in some countries, vaccination coverage in these groups is lower than in the general population. And in other places, vaccination coverage is lower in socially vulnerable groups, such as indigenous and Afro-descendant communities, putting them at even greater risk. Ultimately, each country is only as protected as the most vulnerable in their population. The rise in cases should serve as a wake-up call. When people get sick, hospitals get overwhelmed, health systems are challenged, and the number of deaths rise. Masking and social distancing have served us well since the start of the pandemic and are still valid measures to lower virus transmission. Governments should continue to monitor the COVID-19 trends closely, to adapt their guidance to protect the most vulnerable, and always be ready to scale up these social measures whenever there is an increase in cases or in deaths. Each one of us can contribute to these efforts by embracing vaccines, masks, and other protective measures that can slow the spread of this virus. We must not forget the important lessons we have learned over these 2 years. They are key now and will continue to be for the near future. First, we must keep our eyes on the virus. Over the past 2 years, we have built incredibly networks for COVID testing and genomic surveillance. But in the past few months, we have seen testing levels drop in some countries. The highest testing levels were 1,000 persons, and that was reached around January 20th. In many countries in the Americas, but since then, testing rates have been steadily declining. In South America, for example, testing rates in May varied from 0.11 to 2.34 tests per thousand, while in January, these countries were testing between 0.73 and 9.41 people of every thousand. In places where self-tests are available, results, whether negative or positive, are not always reported to health authorities. So we have less information on the overall trends for incidence of disease. The testing infrastructure must be maintained and strengthened so that we can catch signals of new variants and the first signs of a surge early. Testing and surveillance are our eyes and ears for this pandemic and can help governments make informed decisions. Second, countries must maintain capacities of their networks of services in case infections surge even more. We have seen in the past how COVID waves can overwhelm our health systems and healthcare providers. Our investments in ICU and hospital capacity must be maintained to allow us to react quickly to any changes. In addition, we need to scale up capacity to implement a primary care package for timely diagnosis, treatment, and management of COVID-19 patients and post-COVID conditions, with a special focus on the hard-to-reach populations. Strengthening primary care services will also allow us to address people's health needs beyond COVID. These services will help us catch up on all the preventive care and treatments that could not be administered during the last 2 years. And lastly, as countries decide what public health measures are right for them, they must ensure that the most vulnerable groups are fully protected with their primary vaccine series and with boosters where available. When vaccines were first rolled out a little over a year ago, we were all concerned about equity and ensuring enough doses to cover the most vulnerable. Supply then was the most significant barrier throughout 2021, but that is no longer the case. We have sufficient doses to cover those most at risk, and we have an obligation to do so. As cases rise again, there is no better time than now to get a vaccine. Vaccines have the power to protect each of us individually, but also to help protect our communities against the risk of another surge or a new deadly variant. Next week, the World Health Assembly will be convening in Geneva, Switzerland. Member states will gather as a decision-making body of the World Health Organization to determine our global priorities for public health. Resilience to health emergencies is a key part of our agenda. This means that we must build health systems that can quickly identify emerging health threats and rapidly sound the alarm. It means we must be able to respond effectively to slow or stop the impact of health disasters. And it means we must take what we learned from the past emergencies to shape a future where our health systems and leadership are better prepared to face the next challenge. In the case of COVID, we can make that future a reality now. It is a time for us to take advantage of the lessons and investments of the past 2 years to face a potential new surge of infections. The better prepared our health systems are, the less lives we lose, and the stronger and more resilient our societies become.
Thank you. Thank you, Dr. Etienne. Pasamos entonces ahora a las preguntas que nos...
Now we'll go to the questions that have been sent, and we start with a question.
Dr. Etienne, a follow-up to your remarks. You mentioned the importance of maintaining testing and surveillance to track the pandemic. What is PAHO's advice to countries in this regard?
So let me thank you for that question. Since the early days of the pandemic, PAHO's recommendation to countries has been to expand their testing capacity and to use all the available national laboratories. Also to prioritize patients with symptoms, to trace contacts, and follow up with those that may be infected, and to ensure access for all. Testing and surveillance both need to continue so we can trace the course of the COVID-19 pandemic and adjust our social and pharmacological measures accordingly. On testing, we recommend that our member states prioritize the use of COVID-19 diagnostic tests for all cases that require hospitalization due to respiratory symptoms, for patients with respiratory symptoms that are among at-risk groups, for worsening disease, and for health professionals with respiratory symptoms. Testing is also indicated for patients who need to be hospitalized for other reasons, to detect COVID-19, and for professionals with respiratory symptoms who are part of essential and face-to-face services, such as security professionals. Situations where testing is not recommended are for asymptomatic individuals, including their contacts, as a requirement to get out of isolation or to access public places. The most effective prevention measures continue to be complete vaccination with at least 2 doses of vaccines and boosters where available. Also, the correct use of masks, avoiding crowds, and maintaining open and well-ventilated environments. So our advice is the same as it was last year.
Thank you very much, Director. Pasamos entonces a preguntas de los periodistas también.
Now we will have questions from the journalists. One is a general question from Blanca Barladez, Millennium, Mexico. Blanca asks for an update on the variants and the new mutations of SARS-CoV-2 virus. Dr. Perez, please. Yes, thank you very much for this question. Allow me to remind you that through the genomic surveillance system of PAHO, and thanks to the commitment and continuous work of member states, we have over America and the Caribbean, and all of them have been uploaded to the GSEC global network. So when I would say that Omicron variant out of all of them is the one predominating in the 53 countries and territories, which have now all officially reported it. As part of the process of evolution of the virus, we've mentioned this before, and thanks to the ability of quick transmission, then several sublineages of Omicron have been described. In the Americas, the sublineages BA.1, BA.2 have been the predominant ones. The BA.3 has been detected in North America and sporadically in some Caribbean countries and in the subregions of the Andes and the Southern Cone. On the other hand, at the beginning of April in 2022, South Africa reported new sublineages BA.4 and BA.5. These two sublineages have increased their circulation in Europe. This morning we had a conference with WHO, a global one, and there was a great surge, for example, in Portugal, and it has already been detected in some samples, both in Canada and the United States. To this point, none of these sublineages has been associated to increases in the severity of the disease, and they have not changed the clinical form of the infection. Likewise, vaccines have proved to be efficient to decrease the serious forms and hospitalizations due to them and to other variants in circulation. I think this answers the question from the journalist. Thank you very much. Thank you very much, Dr. Perez. Now, a question in English from the Caribbean. Arian Bullock has two questions.
His first question is, health officials confirmed that the country is in another surge of COVID-19 infections. A few weeks ago, 65% of cases were locally transmitted in a week. Survival weekend, a weekend of carnival events, is coming up with an approved 500-person participants at a parade. What should be in place to deal with the increase in cases? Dr. Ugarte, please, the first question.
Thank you, Luciana. Thank you, Ariel. Well, we need to remember and take into account that the pandemic is not over yet, and that all individual and collective precautions, including health and social measures, must be in place, but also they must be adapted to the level of transmission, also to the new cases that are reported, the availability of health services, and of course, the vaccination coverage, particularly for the populations at higher risk to develop severe disease or death. In that regards, we recommend that continue the active surveillance for early detection of new cases, particularly at the community level. The director has emphasized this several times, and today also she addressed this issue of surveillance. Why? Because when we reduce the protection of the individuals, the communities, particularly when the cases are in low numbers, we give opportunities to the virus to transmit from person to person, and eventually to the rise of new variants or new lineages, but also to, most importantly, to continue the transmission of this virus. And it has, of course, high impact on the social, economic activities of the countries, but also in particular for the health and well-being of the population. In that regards, we recommend that all those measures must be in place to control and contain new surges, but also to implement quarantine and isolation and adjust all the public health measures as needed. we all have responsibility to reduce the opportunities for this virus to pass from person to person. And when we are attending large events, and when we cannot maintain a physical distance, we must use masks to protect ourselves, particularly if we have persons that live with us or work with us or interact with us and have conditions that may prompt severe disease in those persons. So working together, we will control that. But expanding the public health measures extremely when the conditions are very low also may cause a high economic impact for the country. So this is must be adapted to the reality of the communities, of the national and subnational levels. Thank you.
Thank you, Dr. Ugarte. Ariel has a second question about tourism. He says the Bahamas is a travel destination and the majority of tourists are American. Currently, the cases have increased in the Bahamas, but also we see cases increasing in the US and mask mandates have been removed in parts of the US. Is it time for more stricter restrictions on US passengers, is asking, that go to the Bahamas? Thank you, Dr. Ugarte.
But yes, this question is also important, and it has also implication for many other countries that also are reducing the mandate of using masks, and they are mostly, voluntary use. Each country must adopt the corresponding measures to protect their own population and contribute to reduce the national and international transmission of COVID-19. At the end, it comes to the adoption of the most efficient measures that will contribute to reduce transmission and the social and economic impact of the pandemic. So if one country, like the Bahamas, for example, is receiving a lot of tourists from countries where the transmission is active, must implement actions for early detection of cases and protect the persons who will be in close contact with the visitors. But please remember that most of the cases, as we've seen in Bahamas, still come from the local population. So it is important to establish that surveillance that we already mentioned several times, because in large epidemics, when the virus is already present in the countries, the most important feature is to early detect the cases that are at the community level and implement all the measures to reduce the transmission and control those surges. Thank you.
Thank you, perdón, estaba preocupada con el chat. Gracias, Dr. Ugarte. Pasamos a una pregunta de Matías.
Thank you, Dr. Ugarte. Now we have a question from Medscape in Argentina. Matias asks, Argentina seems to be entering its fourth wave, and other countries of the region talk about the arrival of a fifth wave of transmission. Given all that we've learned from prior waves and the dynamics of evolution of the virus, how likely or not likely is a scenario where we can foresee designing more specific vaccines whose formulation is adjusted yearly, like, for example, what happens with seasonal flu vaccine? Dr. Barbosa. Thank you very much, Matias, for your question. Matias, as the director has underlined, and my colleague Ciro, the pandemic is not over. So, of course, we will have situations related to relaxing the measures, opening borders, and just relaxing the measures, and how this is related to vaccines. First of all, we need to make sure, as has been underlined here today, that vaccines that we have continue to be effective, very highly effective, to prevent serious cases. There are also two situations. It's if we could have a vaccine that would grant longer lasting protection. And this is something that happens with several vaccines. Tetanus, we have to renew every 10 years, influenza every year. So this is nothing new for vaccines where you need to give them and modify them. But we also should develop vaccines which could be more specific for the variants that are circulating. Those are two possibilities that are there in the field of vaccines, and people are working on those too. There are pharmaceutical companies or centers of research that are looking for vaccines that will grant universal protection for any COVID variant. And there are other producers that are trying to develop vaccines that are better adapted to new variants. But what we do know today is that the EUL approved vaccines, all the surveys, all the studies show that they continue to grant very high protection against severe cases and deaths, and that senior citizens whose immune system is lower should receive another booster because the effectiveness goes down after a while. Thank you, Dr. Barbosa. We have other questions about masks, which in many cases, those mandates are no longer. A question from Mexico, Laika Troy.
People who live here use a mask when in proximity with tourists.
Whether the people
carry us into the next year, 2023, or not using masks. Pero tenemos también, por ejemplo, de Marcos Dueñas.
For example, we have from Marcos Dueñas from Televisa Mexico, who is asking, Mexico has abandoned many of the measures regarding the wearing masks in open spaces. What is the recommendation right now? And in the likely increase of the number of cases, and also a question, I am combining all the questions we have by Jason Ureña from Costa Rica today. He is asking, what is PAHO's opinion about Costa Rica eliminating the mandatory mask wearing order? I don't know whether you could address all of the questions right now, Dr. Ugarte. Thank you, Luciana, and I thank you for the questions. And risking repeating my comments, we are waiting for the pandemic to come to an end as soon as possible. And as part of that process, we have the individual responsibility as well as the collective responsibility to reduce any responsibility and any opportunity for the virus to convey from one person to the other, in particular when the virus is present in our communities. The problem is that the presence or the diminished or reduced or significantly lower presence of the virus in the communities has meant that the population and the communities are deciding, for example, to reduce the mandatory nature of the masks and also to approve mass events and also not wearing masks in mass transportation. This pandemic has shown to us that whenever we relax those measures without adopting specific measures in places where transmission may be high, after very low levels of cases, we see a significant increase that later on produces more hospitalizations and deaths. But in addition to that, they maintain the transmission of the pandemic. And we are seeing this in developed countries as well as in developing countries. To that end, we recommend for people to wear masks whenever they cannot maintain physical distancing, in particular in places that do not have good ventilation, and also when they are conducting work that could imply exposure to individuals that might be unvaccinated or who may have been in contact with many other individuals. The main measures, and they have been mentioned already in this phase have to do with that individual who is not vaccinated. Please get vaccinated, because vaccination is the best protection for you and your own. Complete the full schedule of the vaccine, and if you or someone is at risk because of health, because of medical situation, or because of work, please get the booster. Whenever it is possible, promote protection measures. And if someone within your environment or yourself has any symptoms, please consider that those symptoms are COVID until proven otherwise, not the other way around, because that's the way we can show that we have solidarity towards other individuals and we can protect them. So each country adopts their measures based on their own situation, and wearing masks and vaccination are measures that the countries are implementing to protect their own population, but also clearly their economy. And here we call upon the population so that they complete their vaccination schedule, but at the same time for them to report suspected cases. If you have, for example, antigen tests or tests at home for COVID and you find you are positive, isolate yourself, wear a mask, report to the health services, and the health services will be able to provide you the care that you may need. This is joint work, and we should all continue to work. We hope, as the question said from our colleague from Mexico, let us hope that these measures are not underway until next year, but this pandemic has shown us that after very, very low levels of cases, we see new cases crop up, and we hope not to have a more aggressive variant, and this is our responsibility. Thank you. Thank you, Dr. Ugarte. Now we move on to a question from Nicaragua. Killian Romero from Confidencial is asking an update as to the vaccination situation in Nicaragua, and also the recommendations we would have for the authorities as to vaccination. Dr. Barbosa. I thank you, Kaylin, for several questions on Nicaragua. To sum up, PAHO supported Nicaragua and other countries from Latin America and the Caribbean to develop a nominal vaccine record registry for COVID-19 vaccines. It has been implemented in Nicaragua starting in March 2021 throughout the country. That system provides detailed information, and Nicaragua, as well as the other countries in the Americas, has been sending on a weekly basis information on vaccinated individuals with the first and second dose, and they have sent all of that information to PAHO that is consolidated in PAHO's dashboard and on our website. Nicaragua has already received a shipment with more than 5.6 million doses through COVAX. They are going to receive an additional 2 million this year through the facility, and they also have bilateral agreements, and they have received donations from other countries. Based on the information provided to PAHO, Nicaragua has more than 4.7 individuals vaccinated with the full schedule. This represents 74% of the population older than 2 years, and they continue with vaccination, and they are also using the vaccines in an effort to attain populations that have more difficulty in having access. So we continue with that recommendation for Nicaragua, that is to say, to continue with vaccination, to try to identify whether there are vulnerable groups such as the elderly, individuals with chronic diseases, individuals with some sort of immune deficiency who could have access to the third dose that is recommended for many persons within these groups. Thank you. Thank you, Dr. Barbosa. We move on to a question from Panama. Enrique Cardenas from La Prensa is asking, Panama is facing the fifth wave of cases. What is PAHO's recommendation to avoid an impact that is similar to the previous wave that had almost 12,000 cases a day? Dr. Ugarte. This question is also related to the previous questions, even though in the case of Panama, we observed that the country is showing a significant increase of new cases, even above the one observed at the same time in 2020-2021. This shows that the variants seem to be more transmissible. Therefore, whenever we give an opportunity to the virus to be transmitted from person to person, it does so easily. And this is another reminder that one of the measures to reduce transmission that has proven to be efficient beyond other measures is wearing a mask properly, in particular when we are in close contact with other individuals. Do so. It is a situation of protection and of showing the others that we are concerned about the health of the community. Sometimes in situations when there are very few cases, individuals wearing a mask do it fearful because there are only a handful wearing a mask and the rest is not wearing a mask. Well, if the rest is not wearing a mask, I am not going to wear a mask. That is something that has shown us that given variants such as the one that we are currently observing, we will have an increase in the number of cases. So the actions that I mentioned before should be applied. Protect yourself, get vaccinated, and protect others. This pandemic is still with us and will stay longer if we do not implement those measures. Thank you. Thank you very much, Dr. Ugarte. We have important messages. Now we move on to another topic that has to do with acute severe hepatitis of unknown etiology. We have some questions from Mexico in the chat, in the Q&A button, and also from BBC World, Felipe Lambas, who will be asking his questions live. Felipe, if you are there, please go ahead. Yes, good morning. Yesterday, PAHO updated the number of cases. There are 429 all over the world. 6 died and others needed a transplant. How many of those cases are in Latin America? I would like to know if you could offer me information as to how many in each country, how many are being investigated for being potential cases, how many transplants, and how many deaths, if any, all of that broken down by country if possible. What are the ages, and also how recent is the information you have? Thank you. Thank you, Felipe. Dr. Perez, please go ahead. Thank you very much, Felipe, for that question. And this will also allow me to answer the question by Patricia Rodriguez in the chat. As you clearly indicated, the cases that have been reported as of May 15th are 429 potential cases of acute hepatitis of unknown etiology in 22 countries. These numbers change. They change daily because based on as the countries in research and confirm cases. Out of the 22 cases, there are 22 countries, there are 12 if we compare them against the 6 that we had last week that have reported more than 5 cases. Most of these 12 countries, 9 of them are completely in the European region. The 10 remaining countries have been, I said that there were 22. The 10 remaining countries are reporting fewer than 5 cases, and at least 40 additional cases are still to be classified. There is a definition for the case, and they're being investigated by the countries for classification purposes. As to changes against the situation we had last week, as you mentioned, 6 children have died, 26 required transplant, and in general, in children younger than 5. So that is almost 75% of these cases have occurred in children that are younger than 5. Indeed, through the international health regulations in the region of the Americas, some countries have reported cases or cases that follow the definition used for research. And at this point in time, I do not have the accurate numbers that you're asking me to provide, but I can send them to you after this press briefing. But I would like to insist that even though there are several investigations or cases under investigation, the information that we have about the etiology, the lab situation, and the continuous clinical data, this is all limited, and we have not been able to identify the etiology that is causing this event. It may take some time before we can actually establish the mechanisms that led to the pathology. We have several hypotheses. One of them, they have talked about adenovirus F41 as one of the agents that has been involved, but there have also been some other underlying causes related to these cases. They are also investigating SARS-CoV-2 as a co-infection or as a previous infection, as a pre-infection in those patients acquiring the adenovirus infection. This week, an interesting communication was produced in the scientific literature that is also referring to these mechanisms and whether an earlier infection of COVID in children, that is to say, any association to an early infection with COVID that may have taken place before, and that has also persisted in the bowels. And whenever there is an adenovirus infection with an activated immune system, there could be new swelling, but this is just a hypothesis and we do not have enough data to support it. Now, we do know that SARS-CoV-2 in adults may or has been associated with hepatitis, but not much is known that this may happen in children. Therefore, what are we doing? Considering the situation, we are working with all of the countries, the member countries in the region, to focus their efforts on investigating the cases that meet that operational definition that has been given to the countries instead of implementing universal surveillance. So PAHO, WHO have proposed a standardized form for data collection and reporting of the data to guide this research. And we're also working as we receive data and as we collect data in a standardized fashion to be able to compare them. We are analyzing several studies to determine the etiology. As the investigation, the research moves forward, the recommendations for prevention, treatment, and control will be updated. I would like to remind you that we have seen several reports that are available on our website. The first one was published on April 23rd, another one on the April 25th. We repeated another one on the 29th, on May 10th, and yesterday we published another one. And there is a great deal of information for you to consult there. Thank you very much. Thank you, Dr. Perez. This is an important topic and highly interesting for the countries. Now we are going to move on to a question by Javier Hernandez Garcia for Telesur Mexico regarding vaccination in children. Javier is asking, now that the Pfizer vaccine has been approved by FDA to be administered to children older than 5, is it the possibility of vaccinating children younger than 5 being assessed. Dr. Barbosa may be able to update us on the recommendations for children up to 5 and older than 5. Thank you. Thank you very much for the question. There are two conditions to recommend the vaccine. Countries do have their own regulatory authority. In the case of Mexico, it is Perez, and the regulatory authority conducts an assessment based on a file presented by the manufacturer, and they can authorize the vaccine for administration in children. This is a decision to be made by each country, and this is greatly different from one country to the other that have been using several vaccines in children and teenagers. The other model is the emergency use authorization that is granted by WHO. So we follow WHO recommendations and also the Strategic Advisory Group on Immunization, SAGE, that issues recommendations that we use. A country in a sovereign fashion can decide whether to accept the data and recommend the vaccine they deem proper. From our own point of view, we think it is important to review access to vaccines, which is different based on the country. So far, we only have WHO recommended vaccines for children who are 5 years of age or older. An FDA authorization is only valid for the US. COFEPRIS only authorizes vaccines in Mexico, and FDA only does so for the US. Clearly, this is a path that will be followed. There are many manufacturers that are carrying out studies in children younger than 5. So I think that in the upcoming month, we are going to have the possibility from WHO to issue a recommendation on vaccines for children younger than 5. And also it is important to vaccinate with a strategy that is to protect the most vulnerable first, that is to say, to have the elderly, the individuals with underlying diseases, the unvaccinated, provide all of the doses, and then move on to children who have a lower risk of having a severe disease. But then after the most vulnerable groups, we should be vaccinating younger children, which becomes a priority. So there are several decisions by the countries in the region that have authorized vaccines for children older than 5 and younger than 5 in some cases, and also for WHO, it is Pfizer, and for children, young children, and there are new recommendations or new information for new vaccines to be authorized for emergency use in children at that age. Thank you very much. Thank you, Dr. Barbosa. We move on to a question by Daniel Colin from TN23 in Guatemala regarding a different topic. The countries in the region of the Americas should be alert to cases of monkeypox, and this is because of the detection of several cases in Europe. Dr. Perez, please. Thank you very much for that question, because the media has been showing a great deal of information. So what is the monkeypox? The monkeypox is a zoonosis, that is to say, this is a disease that is transmitted from animals to human beings. There are some incidental situations. It usually occurs in the jungle or forest areas of Central Africa or Africa in general. So it is known as monkeypox because it is conveyed by or transmitted by the monkey, and it is part of the orthoviruses. So how is this disease expressed? There is swelling, and it is systemic. It may be mild with some general malaise and some headache and some skin rashes, up to more severe disease and death. It is transmitted by droplets, or in this case, drops, larger drops, and it takes 6 to 13 days for incubation, and it could lead up to 21 days. So whenever there is a tracing of contacts, it is done up to 21 days. So what has been the situation globally? First, we had a first case that was reported through the international health regulations on May 7th. This was a person that traveled from the UK to Nigeria and then went back to the UK. And he developed a rash on April 22nd, and it was detected on May 4th. So it was suspected monkeypox. He was isolated, and there has been tracing of the contacts. And as I mentioned before, that is done up to 21 days, and none of those contacts has developed so far any disease. However, we do not know the source of the infection in Nigeria, and there is some risk of transmission. That is to say, the transmission could continue within that country. However, and this is completely isolated from these cases, on May 13th, a family was identified that once again is not linked to this initial case. It was identified in the UK, and they had not traveled, or they had not reported any trip to Western Africa. That's where the endemic place of the disease. The investigation in these cases are underway, and so far, 4 additional cases have been identified among the assistance of some clinics that see men who have sex with other men. So there hasn't been any possibility to discard additional chains of transmission for the virus. And also on May 18th, that is to say today, Portugal, by means of the General Health Office, has confirmed that they had more than 20 suspected cases of infection through monkeypox in Lisboa and also in the Valle del Tajo. And 5 of those cases already have a positive result confirmation in the case. And also in Spain, the health ministry issued an alert to the communities because they also detected 8 patients in Madrid. All of the cases have been diagnosed in men having sex with other men. Therefore, what do we recommend? Any disease that is observed during a trip or coming back from an endemic area should be reported to health professionals, in particular analyzing the current vaccination record. And individuals traveling to endemic areas should avoid contact with diseased animals that may harbor the pox virus. Even though it is called monkeypox, it is also transmitted by rodents and other primates. So they should abstain any contact with these, from contacting these animals or from being in contact with these animals. And it is key to be alert and raise awareness about these diseases. And clearly, it is basic to have or to implement personal cleanliness measures, and also among the health workers who are assisting those patients. I think I should add something else, that in the region, we also have reference labs that can provide support with the diagnosis in case of need. And I think that I have completed the answer. Thank you. Thank you very much, Dr. Perez. Now we're reaching the end of our session. We are going to conclude with a final question for our director, Dr. Etienne.
From Carmen Paun from Politico. Carmen would like to have an update on vaccination levels in the PAHO region, as well as an update on access to COVID antivirals. Dr. Etienne, please.
So, well, let me thank you, Carmen, for that question. So far, more than 698 million people in the Americas have completed their vaccination schedule for the COVID-19 vaccines in all 51 countries and territories in our region. So yeah, we can celebrate the fact that over 1.8 billion doses of COVID-19 vaccines have been administered across the Americas, preventing serious disease and death. So we are advancing, and all countries and territories now have a good supply of vaccines. Our goal of vaccinated 70% of the population by the end of June has already been reached by 14 countries, and others are getting closer to there. There is, however, a smaller group of countries and territories, 11 of them, that are still working to reach what was the December 2021 goal of vaccinating 40% of their population. So we have some ways to go. With respect to antivirals and other therapeutics, PAHO is supporting countries that want to gain access to these medications. PAHO publishes a monthly systematic review that evaluates therapeutic interventions for patients with COVID-19 and presents the most recent evidence on the efficacy of these interventions, on hospitalizations and mortality, and of course on their safety. PAHO's COVID-19 treatment guidance guidelines panels has emphasized that countries should direct their efforts towards increasing the coverage of the full vaccination schedule in order to effectively and safely reduce viral transmission, severe cases, and SARS-CoV-2 associated mortality. Thank you for joining us again today, and we will see you in the next 2 weeks.
Thank you very much, Director, for your final answer to this question about the next sort of steps on therapeutics and, of course, continuing the vaccination campaigns. Colegas, llegamos ahora al final de nuestra sesión.
Colleagues, we have reached the end of our briefing. We will have our next briefing within 2 weeks, but please be alert because we will be sending emails, and we are also open to receiving any requests and questions, follow-up questions, and you can send them to mediateam@paho.org. Please remember that you can find more information as to the vaccination status, detailed information on our website, for example, vaccination dashboard, where you're going to see all of the countries and also the administration and update of the most recent information. Thanks again for participating, and we see you in 2 weeks. Thank you. Thank you. Goodbye.